Thank you, Clywyd, and thank you for your statement today, Minister. It is no doubt welcome that the Welsh Government continues to recognise the need to provide funding for bereavement support and continues to recognise the important role that bereavement counsellors have for those who have lost loved ones. As you are aware, grief is very specific to an individual, and bereavement support cannot be a one-size-fits-all approach, especially considering that different communities have different individual customs that reflect their heritage and faith beliefs. With this in mind, Minister, I'm keen to know how you're assessing bereavement support in terms of evaluating the changing culture around death and ensure that appropriate support is given. As you will know, Minister, we have a tendency not to talk about death or dying and prefer to use colloquialisms and much softer language, but research has shown that this can add to the problem of coping with death. For instance, it can be confusing for children, those with learning disabilities, people who are neurodiverse, those who face challenges processing language, and those whose first language is not English. Findings show that a large proportion of our population do not understand the language and terminology around end-of-life care. For instance, 78% of respondents to Marie Curie's Public Attitudes to Death and Dying in the UK report to not understand the meaning behind an advanced care plan. Helping people come to terms with death as part of the life cycle is a positive step towards helping to improve health and well-being, especially mental health. And if people are more aware of death and are prepared for it, they're more likely to be able to cope. Therefore, Minister, what actions are you taking to improve sensitive understanding of dying, death and bereavement for children and those groups I have mentioned? I feel that there's an opportunity to embed this in schools as part of a holistic education approach. Sadly, Minister, but completely understandable, there's also real social reluctance to talk to parents who have lost a child. This is due to a myriad of reasons around people not feeling comfortable enough, not knowing what to say, and not knowing how to help. And this can further worsen the loss. And this is where organisations like Tuish can massively help. Parents often need access to a more specialist support, but like many other NHS departments, waiting lists in Wales are considerably high, which often leaves people exposed to the consequences of deteriorated mental health. What targets has the Welsh Government set in terms of offering bereavement support to parents, and what actions are you taking to meet those targets? There is evidence that shows considerable inequities relating to different types of death. For instance, there are more services available for adult death, but fewer services for pregnancy loss and stillbirth. You have mentioned in your statement that significant progress has been made on the pathways for children and young people and pregnancy and baby loss. Are you able to outline what this progress is and how resources will or have been allocated to them? Because as you no doubt agree with me, it is extremely important that we don't overlook progress without understanding, and if progress has been made, it is right that we fully understand and appreciate the work that has been done. Turning to regional disparities across Wales, there are particular challenges in rural Wales attributed to the sparse layout of the health service. There's a lack of support services in North and West Wales, particularly with regards to the support that is delivered outside of hospitals. Whilst the £3 million you have mentioned yesterday is a notable figure, it is likely to be insufficient to address this issue. What steps are you taking to support community infrastructure and local support networks in helping to deliver bereavement services in these areas? Finally, I would like to raise the issue of funerals. Funeral costs are in the thousands of pounds, and this can put additional burden on a family or loved one who are grieving. I'm sure you are aware of the no-frills funeral options that are available, which are seen as more cost-effective and accessible for those who are suffering financially. However, whilst these funerals have their place, it has been highlighted that many families regret opting for such services as they're not able to remember or celebrate their loved ones in a way that they would have liked to, and this undoubtedly complicates the grieving process. How is the Welsh Government encouraging those involved in providing funeral arrangements to be transparent about costs, and what wider financial support do you believe should be offered if families are struggling to pay for funeral arrangements? Thank you.